Hi everyone, it's Maddie. Welcome back to my channel. Welcome to day 17 of Diabetes Awareness Month, November 17th, 2018. I hope you are all doing well, and if you are new here, welcome. I'll do a quick recap. My name is Maddie. I've been living with type 1 diabetes since July 22nd, 2018. And I'm kind of on YouTube to kind of document my journey with it and my journey with life in general, because I like to do a lot of other things, because diabetes is only a part of me and it isn't the whole thing. So with that being said, let's jump into question 17. So question 17 is, what types of doctors or other medical professionals do you see to help manage your diabetes? First of all, I would say most type 1 diabetics especially do have a primary care doctor. What is a primary care doctor? A primary care doctor is the type of doctor who has a general knowledge on just about everything. They're the ones you typically see if you have some sort of weird infection, like a strep throat. You'd go to the urgent care, the nurse would take care of you and, give you the medication or whatever you need, the antibiotics, and they're the ones that kind of get to see all that and take care of you with that. They're also the ones that give you a physical or an annual exam every year to make sure that you're well and healthy. So definitely a type 1 diabetic, or any diabetic in general, should be in close contact with a primary care doctor. The second type of doctor that we typically see is called an endocrinologist. An endocrinologist is a doctor that specializes in the endocrine system, that typically has to deal with, like the pancreas, the adrenal glands, having high blood pressure problems. They kind of deal with the whole entire hormonal endocrine system. And typically speaking, an endocrinologist is also going to be very specified, and they're going to be treating a lot of diabetics because that is a common problem with endocrine systems. They also specialize sometimes in thyroids too, because that is part of your endocrine system. So we typically see an endocrinologist a few times a year. What they do is they evaluate our A1Cs, make sure that our medication rates are right and proper, that we're not having too many low blood sugars, that we're not having too many high blood sugars. They also help us get on the newest technology or change to different prescriptions, such as continuous glucose monitors or pumps. So they are very important in the role of a diabetic. However, some diabetics choose to have their primary care doctor help manage their diabetes, and some, like me, have an endocrinologist, and some choose to kind of have both help them, which is totally fine. The third doctor that comes into my head is some sort of ophthalmologist or an optometrist. Typically, we go see these people about once a year for a full dilated eye exam. This has everything to do with diabetic retinopathy. We want to catch that early and catch any damage to the eyes that may have been caused from high blood sugar, so we go get a fully dilated eye exam every year to make sure everything is in working order, and to make sure that we don't have things like glaucoma, macular degeneration, cataracts, you name it. I've already had my first eye exam, so for those of you who haven't had one yet and you're newly diagnosed, or you're a diabetic for years and have never had one and you want to get one but you don't know what to expect, or you're nervous, I'd like to make a video on kind of my first time experience going to a fully dilated eye exam and kind of what to expect with that. So give this video a big thumbs up if you want me to do that. The fourth type of doctor or healthcare professional we typically go see is some sort of diabetes nurse or diabetes educator. They typically work closely with your endocrinologist, and they're there. You can call them and they can kind of help guide you through making medication adjustments. They're also there to kind of help train you on learning how to use certain continuous glucose monitors, pumps. They're also there for you if you need to remember or practice. If you're brand new diagnosed diabetic, they'll teach you how to give you your shots, check your blood sugar, use a new monitor, use a new meter, anything and everything you can think of, they can help train you on. So they kind of work in conjunction with your endocrinologists. And the other doctors I can think of would be more if there's more complications with diabetes. Some people might go see a cardiovascular doctor that deals with problems that if you have heart problems. You might go see a nephrologist, which deals with kidneys. If your kidneys function is starting to degrade, they can kind of help you along with that. And if you have like neuropathy, you might go see a neurologist. Or if you have problems with like your feet or diabetic nerve pain, you might go see a podiatrist. Another thing people could maybe go see would be a dermatologist if you have problems with your skin, or if you have issues with your skin related to diabetes related skin conditions. I wanted to pop on here quick, and I'm in the middle of editing this video, but I briefly forgot to mention a nutritionist. A nutritionist is someone you'd go see to kind of help you learn how to portion out your foods or be able to make healthier food decisions. I already saw a nutritionist one time. I do not need to go back. She is completely satisfied with the food choices I make, but they're kind of there to help guide you with that. Some people go see them more often depending on if they have issues keeping a healthy diet or they just need help with their diet in general. Other people can go see nutritionists too if they have just, like problems in general, like if they're anemic or they need special amounts of like potassium or sodium and they need to go find a balance with that. So with that being said, let's jump back into the rest of the video. This is about all the medical professionals that I can think of. If I missed any, I apologize. But let me know what kind of doctors you go see regularly. I would say, or healthcare providers, I would say I basically stick with 4 main ones. I would say my primary care, my endocrinologist, along with a diabetes nurse or a diabetes educator, and a ophthalmologist for a dilated eye exam. I have those 3, and that's typically what I take care of. And, one more thing. I'm going to be a dental hygienist, so it is very important that diabetics go see a dentist a couple times a year and get their teeth cleaned so that they keep their oral health up to par. And I obviously go see a dentist. I'm going to be a dental hygienist. I go twice a year like everybody should. If you guys want me to make a video on what the importance of oral health is in diabetes, let me know because I'm all up in that alley. I'm studying to be a dental hygienist, so it's going to be rather interesting if I do a video on this. So I might do that. So basically for me, it's the endocrinologist along with the diabetes nurse, my primary care doctor, an ophthalmologist, and a dentist is primarily what I have seen so far. I have not had to see any other types of doctors because I haven't really had any complications. But that's all I can think of. Let me know down in the comments below what kind of doctors you go see for your diabetes, or if you're non-diabetic, what kind of doctors you go see anyway for other conditions you may have. I'm curious to know. Be sure to hit that subscribe button if you want to see more videos from me, and don't forget to turn on that notification bell so that you never miss when I upload. Until tomorrow's video for day 18 of Diabetes Awareness Month, take care, God bless, and if you are a type 1 diabetic, I hope your blood sugars are doing well today. Bye, everybody.